1. Which of the following is the primary role of a Certified Outpatient Coder, COC? A. To ensure inpatient claims are coded correctly. B. To ensure outpatient facility coding and billing compliance. C. To provide direct patient care in outpatient settings. D. To manage hospital supply chain inventory. 2. Which coding system is primarily used for reporting outpatient hospital procedures? A. CPT. B. ICD-10-CM. C. ICD-10-PCS. D. HCPCS Level 2. 3. Which of the following would most likely require the use of a modifier in outpatient coding? A. A patient admitted for overnight observation. B. A patient receiving the same procedure on both arms. C. A patient's diagnosis being updated post-discharge. D. A patient transferred to inpatient care. 4. In outpatient coding, the term facility component refers to A. Professional services provided by physicians. B. Hospitals' technical resources and overhead costs. C. Independent laboratory services. D. Patients' insurance premiums. 5. Which organization develops and maintains the CPT code set? A. Centers for Medicare and Medicaid Services, CMS. B. World Health Organization, WHO. C. American Medical Association, AMA. D. American Hospital Association, AHA. 6. Outpatient coders use ICD-10-CM primarily for A. Reporting patient outcomes. B. Reporting patient diagnoses and conditions. C. Reporting durable medical equipment usage. D. Reporting nursing documentation. 7. Which modifier indicates that a procedure was performed on the left side of the body? A. -50. B. LT. C. RT. D. -59. 8. When coding for outpatient encounters, the coder should sequence A. The primary diagnosis that required the most expensive procedure. B. The principal diagnosis, followed by additional diagnoses. C. The first diagnosis alphabetically. D. The diagnosis most recently discovered. 9. Ambulatory payment classification APC groups are used to A. Classify inpatient admissions. B. Determine reimbursement for outpatient services. C. Assign professional fees for physicians. D. Establish nursing care plans. 10. Which of the following services would typically be coded using HCPCS Level 2 codes? A. Colonoscopy. B. Durable medical equipment. C. Laparoscopic cholecystectomy. D. Endoscopy. 11. In outpatient coding, which document is most essential to identify the reason for service? A. Laboratory results. B. History and physical report. C. Operative report. D. Physician's order. 12. The principal diagnosis in outpatient coding is defined as A. The condition established after study to be chiefly responsible for outpatient services. B. The first diagnosis listed in the patient's chart. C. The chronic condition most affecting the patient's care. D. The diagnosis that required hospitalization. 13. Which coding guideline applies specifically to outpatient diagnostic services? A. Report only confirmed diagnoses. B. Report signs, symptoms, and abnormal findings. C. Report only chronic conditions. D. Do not report provisional diagnoses. 14. Which modifier is used when a procedure is performed bilaterally? A. -50. B, -25. C, -26. D, -59. 15. When assigning CPT codes, which section would you use for radiology procedures? A, 10,000 to 19,999. B, 70,000 to 79,999. C, 80,000 to 89,999. D, 90,000 to 99,999. 16. The Outpatient Prospective Payment System, OPPS, is primarily used by A, Medicare. B, Medicaid. C, private insurance companies. D, workers' compensation programs. 17. Which of the following best describes HCPCS Level 2 codes? A, National Codes for Medical Supplies, Equipment, and Non-Physician Services. B, Local Hospital Codes for Inpatient Claims. C, Codes used only for mental health services. D, Codes assigned only to laboratory tests. 18. Which of the following is true regarding outpatient observation coding? A, it requires ICD-10 PCS procedure coding. B, it may require separate codes for evaluation and management. C, it is reimbursed only when the patient is admitted. It does not require diagnosis codes. 19. The CPT codebook is divided into A, 4 main sections. B, 6 main sections. C, 8 main sections. D, 10 main sections. 20. In outpatient coding, a global surgical package includes A, preoperative, intraoperative, and postoperative services. B, only the operative procedure. C, nursing and pharmacy services. D, radiology and laboratory tests. 21. When coding chemotherapy administration in an outpatient setting, coders should reference A, CPT medicine section. E, CPT evaluation and management section. C, HCPCS Level 2 miscellaneous codes. D, ICD-10 PCS guidelines. 22. Which modifier indicates a distinct procedural service? A, -26. B, -59. C, -50. D, -22. 23. Outpatient coders must follow the present on admission indicator for A, ambulatory surgical procedures. B, Medicare inpatient claims. C, Medicare outpatient claims. D, emergency department visits. 24. When a patient receives multiple EM services on the same day, coders must A, report only the highest level service. B, report each service with a modifier if appropriate. C, report each diagnosis code without procedure codes. D, assign codes based on physician preference. 25. Which of the following is the correct CPT section for anesthesia codes? A, 00, 100, 01999. B, 10,000 to 19,999. C, 70,000 to 79,999. D, 90,000 to 99,999. 26. In outpatient settings, ICD-10 PCS is generally not used because A, it is only for inpatient hospital procedures. B, it is not recognized by CMS. C, it does not include radiology codes. D, it is replaced by HCPCS Level 3. 27. Which of the following statements about modifier 25 is correct? A, it's used to indicate a bilateral procedure. E, it is used for a significant, separately identifiable EM service on the same day. C. It is used to indicate a reduced service. D. It is used for professional component billing. 28. Which of the following documents is most important when coding outpatient surgical procedures? A. Pathology report. B. Operative report. C. Discharge summary. D. Nursing notes. 29. For outpatient laboratory tests, which coding resource is most commonly used? A. ICD-10 PCS. B. CPT Pathology and Laboratory Section. C. ICD-10 CM Volume 2. D. DRG Grouping Guidelines. 30. The purpose of an NCCI edit is to A. Prevent improper coding and billing of services. B. Assign payment classifications for hospital stays. C. Identify patient comorbidities. D. Determine medical necessity. 31. Which type of outpatient service requires the use of evaluation and management (EM) codes? A. Imaging procedures. B. Ambulatory surgery. C. Physician office visits. D. Laboratory testing. 32. In outpatient coding, which of the following codes would represent a supply such as a wheelchair? A. ICD-10 CM. B. CPT. C. HCPCS Level 2. D. ICD-10 PCS. 33. The abbreviation OPPS refers to A. Outpatient Procedural Payment System. B. Outpatient Prospective Payment System. C. Outpatient Physician Payment Standards. D. Outpatient Professional Payment Schedule. 34. Which outpatient coding guideline applies when reporting suspected conditions? A. Code as if confirmed. B. Report signs and symptoms. C. Do not report unless confirmed. D. Code using ICD-10 PCS.